for choosing St. Francis Medical Center for your upcoming birth experience. We have been serving the community since 1945, and we deliver over 4,500 babies a year. We hope to answer many of the questions you may have about your upcoming birth experience. The healthcare team here at St. Francis Medical Center recognizes that everyone's birth experience is unique. Therefore, we are here to support you in any way possible.
So OBGYN is my passion, so I've been doing this for a long time, and I love being invited to birthday parties.
We are so excited that you are here, and we want to make your experience a magical experience. All our labor rooms are private. Each room has a private bathroom you or your family can use while you're in labor. We will provide everything you need. We have a comfortable couch which turns into a bed. You will remain in labor and delivery until you deliver. You approximately stay in there for 2 hours before you're transferred to our mother-baby unit.
We know how important your childbirth is, and we want to understand every aspect of it. From the time you walk in to the time you discharge, we will be providing you excellent, quality, and compassionate care.
The majority of our nurses are RNC certified, which means they have taken an additional test to say they are a specialist in OB.
During the labor process, we're always here to help you, whether it's to help control your pain, whatever you need. If you don't want anything for pain, we're also here to support you in whatever way you need.
If you need some coaching with breathing, they will help you. If you need pain medicine, if you want to use a peanut ball for labor, they will be there to assist you.
When you come into the Family Life Center, you will come into the front desk and be greeted by security. You will be directed to come to our triage observation unit, which is located on the second floor.
If you're not sure you're in labor and you don't want to call your doctor, call us. We're open 24/7.
You should go to the hospital if you feel that your baby is not moving appropriately, if you're having contractions every 3 to 5 minutes that are lasting for an hour or more. You should go to the hospital if your water bag breaks. Do not wait for contractions. If you're having vaginal bleeding, it's very important also to present to the hospital, just because if you're bleeding too much like a menstrual cycle, you could be dilating, so you absolutely could be in labor.
When you arrive into triage, one of the registered nurses will do a full assessment. They will then call your physician and obtain orders for either your admission or your discharge. Upon admission to your labor room, your nurse will do a complete initial assessment. At that time, she will go over the plan of care with you, and she will answer any questions that you may have regarding your care, the facility, or any other concern.
When you're admitted to the labor and delivery unit, just bring your bare minimum. We will provide everything you need. When you get to your permanent room and the mother-baby unit, then go ahead and bring your suitcase and your car seat.
If you happen to be scheduled for a cesarean section or an induction, you will still come to the Family Life Center. You will bypass the triage observation unit, and we will take you into a room where we will prepare you for your surgery or your induction.
If it happens where you're in the hospital and you're needing to have a C-section, we will inform you, we will talk with you, we will talk to your family, and we will go ahead and proceed to a different room to provide the care of a C-section. We have 3 operating rooms here at St. Francis Medical Center, for which we have an operating team that will come in, introduce themselves to you, and transfer you from the labor room to the C-section room.
St. Francis Medical Center has a neonatal intensive care unit, also known as the NICU, to provide special care in the case that your baby requires.
They are able to take care of babies who are at least 26 weeks or above with any complications that may occur during your delivery or even prior to your delivery. For those patients who would like to have a permanent sterilization done, we actually do them now at St. Francis Medical Center. It's called a bilateral tubal ligation, and we do them here at St. Francis prior to you going home after your delivery.
The Family Life Center is a baby-friendly hospital, and a baby-friendly hospital is that we promote breastfeeding. And so gone are the days when babies deliver and are sent to the nursery. We now keep the babies with the moms after delivery.
We have coverage 24/7 for certified lactation educators, and a international board certified lactation consultant. Majority of our nurses are certified lactation educators as well. Anytime you need any help, the nurses are at your bedside assisting you.
After you deliver your baby and you are transferred to postpartum, you are allowed to have one overnight guest. It could be your spouse, your mother, your grandmother, any support person that's going to be available to help you with the baby overnight. You will have a private room and you will have a nurse that will care for you and your baby.
The postpartum unit has 32 beds. Each nurse is assigned to 4 moms and 4 babies. So you can rest assured that one nurse will be taking care of you and your baby.
Visiting hours are 24/7 in our labor and delivery unit, so long as your visitors visit 2 at a time. If you have any questions in regards to your upcoming labor experience, we encourage you to contact our triage observation center and speak to one of the nurses.
So we would like to make sure that when you come that you have had a great experience.
Allow us to make a moment with you and your loved ones by making magic one family at a time.
Congratulations on your pregnancy, and thank you for considering St. Francis Medical Center as part of your healthcare team.